As with the care of the eye when working with a computer, it is equally important to care for one's body, especially the arms and wrist, when working to avoid carpal tunnel syndrome. Dr. Mrs. Sheila Okai-Mensah, an internal medicine specialist and a neurologist in training at the Komfanochi Teaching Hospital in Kumasi, Ghana, had this to say on the topic of carpal tunnel syndrome.
When you take the wrist, there are some bones here called the wrist bones. Now if I turn my palm upwards, there's a ligament which is like a rope-like structure over those carpal bones or the wrist bones. Now this rope-like ligament and the bones form a tunnel. The space in between them forms a tunnel, and that tunnel is called carpal tunnel. Carpal tunnel syndrome occurs when there's an increased pressure within that tunnel. It can be from if there's an infection or a form of inflammation or a swelling of some of the structures in that tunnel, or if there's a tumor in that tunnel. It can cause an increased pressure within the tunnel, and that is what causes what we call carpal tunnel syndrome. Now, with the symptoms, once the median nerve is pressed, it may have difficulty performing its functions. So sometimes it will normally start with abnormalities in sensation, which is you may have numbness in these areas. So sometimes even when someone touches you there, you may not feel it as much as you feel in the other hand or in this finger, which is not served by the median nerve. You can have tingling, you can have pain. It starts off once in a while, then it increases continuously, normally worse in the night, till sometimes if it gets very severe, it can be a continuous pain. And because the median nerve also is involved in motor, as in your ability to move these fingers, it can also affect the ability to move or the strength in these. So somebody with carpal tunnel syndrome, which has progressed, may have difficulty picking things or holding things. So they can pick things and then it will drop because these fingers are weak. So those are normally the symptoms associated with carpal tunnel syndrome. Now, lots of computer users do not arrange their desk and their seats well. Maybe their seats may be too low, their desk too high or too low. So in order to access their keyboard, their wrist may have to be bent or forwards or backwards. So if your table is too high, your hand has to go like this to work. You are increasing the pressure in your hand. Or if your hand has to go like this to work, it works to increase the pressure, which brings about the issue of the carpal tunnel. So if you're able to adjust your table and your chair in such a way that your hand or your wrist can be level as you work, you are not likely to have issues with carpal tunnel syndrome. But that normally does not happen. We don't normally consider people don't consider their arm short, so I need a high table, a high chair in relation to my table. I'm quite tall, so my chair doesn't need to be that high, or maybe I need to raise my table a bit. Those things have to be adjusted in such a way that your hands are level as you work. It's all about keeping your wrist straight. Any movement that maintains your wrist bent forwards or bent backwards in a long duration makes the problem worse. Any situation that keeps you repetitive movement, bending and extending, will make the problem worse. So the idea is to always keep your wrist straight so that the pressure is at its lowest level in the tunnel. So adjust your seating and your table so that your arms are straight whilst you work. You can rest level on the table as you work instead of having to bend them or extend them to work as straight as possible. The idea is to maintain your wrist level horizontal so that the pressures will be reduced and you can avoid the symptoms of carpal tunnel syndrome. Another issue is when we sleep, our hands really bend a lot. And if the pressures in your carpal tunnel are normally okay, you don't really have a problem. But for people who have carpal tunnel syndrome or who are in an occupation like computer users where they bend their hands often, they're already at risk of developing carpal tunnel syndrome. So you would not want the additional increased pressures at night when your wrist bend. So So for those people, they can wear a splint to maintain their wrist in a horizontal position. Now, a splint is anything that is relatively hard enough to support your wrist in a level position. So a splint can be wood, which will be uncomfortable for the wrist, or it can even be a hard cardboard, or there are actual formal braces and splints that you can buy for the wrist, which are cushioned, so they are more comfortable.